slides. I'm going to try and fit in an awful lot, so apologies. But the content that I'm going to be looking at is what is mental health, Glasgow's mental health framework, focusing on nurturing Glasgow, then look at what is one good adult and are you one, the importance of resilience in promoting good mental health, Glasgow Schools mental health policy, supporting Glasgow responding to stress, and useful links online. So I've already spoken to Leanne, and the presentation will be uploaded onto the Glasgow Psychological Service website. It will also be available to your Facebook page to download. So the links are embedded, so don't have to worry about taking any notes. I'm probably going to put off my camera so you don't see me moving around here, if that's all right. And I've asked Leanne to butt in if for some reason the presentation gets hung up in any way. Just like that. So a couple of requests from me, if that's possible. I'm unable to respond to any specific individual or case-related matters on the chat. That's for data protection reasons, so please don't ask any specific questions about children. I will not refer to CAMS referrals or waiting times, as this is outside my remit. And some of the slides I've used when I presented to the group in May 2019 at the Gaelic School didn't seem that long ago. It was a fantastic evening, actually meeting people. But so apologies, it's important to have the framework when talking about mental health. So we're going to start off looking at that kind of framework. So what is mental health? It's defined as what you can see in front of you, a state of well-being. And this is the World Health Organization 2014 definition of mental health. And it's a really helpful one because as such, mental health is conceptualized not simply as the absence of mental illness, but as a wide continuum ranging from optimal well-being to mental ill health. When I started as a psychologist many years ago, when we talked about mental health, it was always seen as a deficit. You were ill, there was something wrong with the person. And even now, when you talk to people, they still think about it as there is something wrong. Mental health is like any other aspect of health. We have to think about it. Your mental health changes on a day-to-day basis. You could be under certain pressures. So mental health is a fluid thing. We have to think about that. That's not just a label to say you're mentally ill. These are some facts that we've used in the past, and this is certainly before COVID-19. There are a lot of research has been done since the COVID-19 outbreak and the impact on young people. And I can certainly send the links, but I wasn't going to try and spend time tonight looking at that. I think that'll be something for the future. But every year, 1 in 10 young people experience a mental health problem. Suicide is the largest cause of mortality for young people under 35. Young people with mental health issues were 8 times more likely to have contact with criminal justice services than young people without such issues. So the number of young people that are actually hitting into the criminal justice system or get into secure care, they have significant mental health issues. And that comes from long-term issues such as deprivation and neglect. 3/4 of children raised in local authority residential homes meet the criteria for a psychiatric diagnosis. And certain groups, protected characteristics, 40% of LGBT young people consider themselves as having mental health issues. So it's a big problem out there. And I think that's reflected in the number of people who are interested in the presentation tonight. I put this slide up because I really like it, because some of the work that Professor Martin Knapp from the London School of Economics carried out. And he talks about adolescence, young adulthood as a key developmental period in anyone's life. Neglect on the scale we see today is not only morally indefensible, but also very costly. And that last line is quite important because he actually, with his team, look at it from an economic perspective and the cost upon the country for mental health needs that are not addressed at an early stage. And a lot of the work that I and my colleagues have been working on is in early intervention and prevention. There is a clear role for specialist services, but we really have to be thinking about how do we prevent people from developing mental health issues and how can we be more supportive. And that fits very well with what education, certainly in Glasgow in terms of the nurturing city, is trying to achieve. And that's what we've been working on the past many years. So these are some of the basic principles, and this came from a paper that went to Education Committee a couple of years ago. And the principles are, why is it so important that education and mental health are linking together? So education is a universal service. All children access education. Without good mental health and well-being, high quality learning and teaching will not impact. You can have the best teachers in the world, you can have the best curriculum in the world, but if that young person is not in a place where they can actually access that because of their mental health issues, then the whole thing is wasted. So we really have to think about the two go hand in hand. Really important point from me, we should think about a continuum from well-being to mental ill health, and I'll show you a slide in a minute or two that indicates this. In Glasgow, we've adopted support should be available in tiers. If you're talking in terms of health, we talk about in stages in terms of education, but starting with having positive relationship with the classroom. And that's why I'm going to touch on nurture through to evidence-based intervention, the therapeutic route supports. So this is the basics of relationships. The minute that young person walks into the classroom, whether it's an early learning centre, whether it's a primary school or secondary school, is the teacher receptive to that young person? Is it a welcoming environment? Do they recognise that young person for who they are? And do they understand what some of the issues they have? And if they do require support, do we have those evidence-based interventions, those one-to-one counselling, the therapeutic supports, the cognitive behaviour therapy? So all these types of things go hand in hand, and it should be seen as a continuum of supports tailored to the young person. This is a quite an important part, and it came through the kind of the mental health task force. Supports and services should be offered within the young person's local community and school where possible. Extracting somebody from their school or community to go somewhere else is not the ideal in terms of excluding them from their community. So we should be thinking about using schools in different ways and community supports. And within education, and this is what we've taken on board in Glasgow, we should focus not on a medical model, actually just giving a label and identifying what the medical issue is here in terms of a mental health issue, but an ecological model. And I'll explain that now. So this is taken from Bronfenbrenner's social ecological model. And what we've done is we've actually adapted that to look at positive mental health and resilience. So if you think about the different layers here, if you put the child, the young person at the centre and look at what they require. So what I've indicated here is things like direct work. So that's cognitive behaviour therapy, support such as seasons for growth, safe talk, respect me, nurturing me. These are things that should be supporting the child directly. But then as you move out through the model, you've got other things such as paths, promoting alternative thinking strategies, very interactive guidance, nurture parenting approaches, and then we move out to the local authority mental health strategy, which I'm going to touch on today. Then look at health and social care partnerships, and ultimately you've got Curriculum for Excellence, GIRFECT, and the mental health strategy. So all these different levels should link together, but the key thing is the child at the centre, and that's why I quite like this model here, because that's what's really important. What does the child or the young person really require in terms of support? We cannot put it upon them. We have to be looking at what their needs are and then trying to tailor that, through what the offer that we have. So this is what's called the Mental Health Improvement Early Intervention Framework. It's called the 6-box model by most people working on it. And this was developed way back in 2011 through working with a range of partners to identify what should be the key areas. So this is what's used within Greater Glasgow and Clyde and certainly within Glasgow education to look at the framework. So anything that has been brought in to support young people's mental health and well-being must fit into one of these boxes. And just looking at that, you can see there's plenty of opportunity. They're flexible enough. So one good adult I'm going to touch on in a minute, resilience development in schools, which is what we're about in terms of education. Resilience development communities is something we really have to be better at looking at. How do we involve youth services, voluntary organisations, third sector to engage with communities? The guiding through the service maze is to do with how the complexity of actually seeking support and referral systems. I'm going to touch on responding to distress because that's an area that I'm really passionate about, and that's to do with suicide prevention and self-harm, and also peer help in social media, because we recognise that young people now look at supports in different ways. So just referring to a book is not effective. They have to have different ways of looking at that. And I'm going to show you a couple of websites that I think are quite important. So this is a continuum of well-being that I would like to be thinking about. And this is what we use in Glasgow in terms of evidence-based intervention. So what you've got on one side is universal level. So that's for all young people. So if you think about prevention, this is something that young people can access day to day in the classroom. But as their issues grow in terms of mental ill health, then we have targeted interventions. So it's a very simple way of thinking about it. So nurture is a prime intervention. It's that relationships approach to engaging with children and young people. Things like restorative approaches and solution-focused meetings, promoting resilience, use of extracurricular activities, sport. And then as you move across to the right, you bring in other interventions depending on the level of need. So things like video interactive guidance, Safe Talk, which I'll touch on, which is a suicide prevention strategy, Friends for Life, Seasons for Growth, which is loss and bereavement. And as you go to the right-hand side towards mental ill health, you're looking at things like cognitive behaviour therapy, EMDR, which is eye movement desensitization and reprocessing, which is for trauma. So a child or young person who's undergone, significant trauma would undergo those one-to-one therapies. So we have to offer that wide range because people move along that continuum. So even people listening tonight may well have children who one day will be towards left-hand side, towards well-being, getting support, but something could happen. They could experience bereavement, they could experience loss. Certainly COVID-19 shutdown has significantly caused problems and increased the potential for mental ill health. So we need to be thinking about that. So it's not just a simple, you're either ill or you're not ill. You move along that depending on where you are in your stage of life. Talking about nurture, so this is a big thing, particularly from the Executive Director, Maureen McKenna. So as a nurturing city, we have implemented whole school nurturing approaches. It's one of the biggest things that has been carried out in Glasgow with probably the past 10 to 15 years. So we've invested heavily within targeted nurture supports through groups in early years. So you've got early years nurture groups in primary, nurture and also secondary. And that's all quality assured, but there's also a real commitment to actually staff development. So we have a nurture training officer, Jenny Kerr, who leads on nurture training, and staff sign up to that on a regular basis to undertake validated courses in nurture. And these are always oversubscribed. So it just goes to show that there's a real buy-in in terms of nurture. So that's the basic offer. If you can imagine a triangle, and at the bottom of that triangle, the big base, that would be nurture. And as we move up the triangle, we'll be looking at more specific supports. One of the things that I'm really interested in, because my colleague Alison Crawford, the other city principal psychologist, and I were developing, or have developed, is all behaviours communication training, which is based on the principles of nurture. There's 6 nurture principles, and one of the principles is all behaviours communication. So this was a training programme that we were requested to develop, which would be available to all staff. And that was in response to behaviour in schools and relationships breaking down. And we have looked at a programme which is a cascade programme where we bring in senior managers, deputy heads, principal teachers, head teachers, and we train them up. And we started in August 2017. We ran an event at Celtic Park for over 350 support for learning workers, and then we started to roll out training across the city. It's a full day's training where the staff come in and are trained up to become trainers, and they're given the resources. So over the past 3 years, until we stopped having face-to-face training, we have now 540 teaching staff as trainers, and the commitment is that every school and early learning centre in Glasgow should complete the modular training. There's 3 modules of this. They take roughly about an hour each, but it also links to other aspects of training. And we're currently developing an online version for staff. And the whole idea of this is to prevent young people becoming distressed. It links very much to nurture and how we understand young people. We also offer this to all probationer teachers. So this is the kind of mandatory training. We've been running for the past, again, 3 years. We had 350 this session, and we did it virtually online using Microsoft Teams. And then the feedback from teachers, from probationer teachers, is really, really positive. And it's looking at practical strategies about how you set a lesson, how you engage with young people. And it's trying to get across, when that young person comes into your classroom, are you welcoming them? Are you understanding their needs? And if they are distressed, how do you respond to that? And there are very specific ways that you have to be thinking about it. It's been really well received by other organisations. We've actually offered training to Glasgow Kelvin College, Voluntary Tutors Organisation, residential care staff, even the school librarians at one point. And then last year, Alice and I trained the staff tutors on the postgraduate diploma in education courses, primary and secondary at Strathclyde University. So we get really into the training at the start of initial teacher training. So that's come down really well. And the key aspects of the modulars is a relational approach. So it's how you engage with young people. It's trying to avoid confrontations. We look at the brain development, because when someone becomes distressed, there are clear issues going on within the brain and how the information is processed. We look at de-escalating a situation. We talk about duty of care and debriefing, and there's a full set of resources. And these are openly available in Glasgow, but we also open up to other local authorities if they're interested, and the feedback is really, really positive in that. So we're looking, our aspiration was to have about 7,000 staff trained. I think we're probably around about 4,000 at the minute, but again, it's just keeping on top of the training records for that. One Good Adult training, we talk about OGA, the One Good Adult, and this was developed by NHS Greater Glasgow and Clyde Health Improvement colleagues, looking at what is One Good Adult. So we've delivered training on One Good Adult to health and wellbeing coordinators in schools and early learning and childcare establishments, and all probationary teachers get this. But what is One Good Adult? Is it a special person? It's not. One Good Adult could be anybody. It's trying to get people to understand that you do not have to have special qualities or specialist training to actually be that One Good Adult. So what you're looking at is that person you can talk to when there's something on your mind, someone you can rely on and trust to help you out in times of difficulty. So moving on to resilience development in young people, schools and communities. This is one of the activities that we carried out as part of the training for all head teachers as part of the mental health policy in schools. We also trialled this through a number of events through the West Regional Improvement Collaborative, which is the 8 local authorities. We also did it at the Scottish Learning Festival with about 150 people. And the activity is you sit down with a very large sheet of paper with 3 circles on it, and you ask people to sit down in their groups and think about what are you offering within your establishment that looks at promoting resilience for young people, families and the community. And most people will start at the centre and then work out, so say, well, we're offering peer support, or we're doing anti-bullying or counselling, and then we're doing some family support work. But the real challenge is when you actually look at the broader one is community. How are we supporting communities? And what I found very interesting, just as an aside, when we did it at the Scottish Learning Festival, there was a group of 15 teachers from Holland, the Netherlands present, and they started at the outside and worked in. So I found that really strange because I'd never seen that before. I must have done this exercise about at least 20 times. And they started off going around about community and then family, and then they worried, or not worried, but they focused on the child, young person. I thought it was very, very different because it just reflects different societies. And it's the one that we have real problems. So when we sit down with schools or head teachers and say, what are you offering? You need to be thinking about community. And that's will probably link to what I'm going to be touching on later when we talk about working with voluntary organisations in the third sector, because we need to be better at doing that. That's something we're thinking about. So I'm just going to touch now on where what we're doing in Glasgow schools. I'm not just selling ourselves here or blowing our own trumpet, but I just want to try and reassure some parents that there is a plan in Glasgow about what we're actually trying to achieve here, and it is a strategy. We've just completed a 3-year education strategy. We're about to start on another 3-year mental health strategy, along with the Health and Social Care Partnership in third sector, which I will touch on just at the end. So mental health training for staff. So in 2018, we worked with one of the charities third sector Place to Be, where we piloted mental health champions training. And this involved 20 teachers and training of senior leaders around mental health. And it was endorsed by the Scottish College for Educational Leadership. Because of that and the feedback from that, they have upscaled the offer. So they're now offering 10,000 places across the country, and Glasgow has been offered 2,000 online training places for Glasgow teachers. This is a 5-week online Champions Foundation training programme, which looks at mental health issues and how you support young people. Each module lasts about an hour and a half, but the working cohorts are 500, and it's supported by a clinical coordinator. So the research or the feedback on this is really, really positive in terms of the uptake and the changes to staff confidence. So this is funded by Morgan Stanley Bank, and this is about to be rolled out in Glasgow. So it's one of it's on my diary to-do list for the next couple of weeks, is to actually look. So every school in Glasgow will be allocated a number of places, and the head teachers will be able to designate members of staff to become those champions within the schools in Glasgow, and hopefully they'll take up that online training as part of their own professional update in CPD. One of the things we were really keen on was a mental health and wellbeing policy for schools. There'd been a health and wellbeing policy in all schools for many years. However, with the demand for supports in terms of mental health, we developed a policy. We worked with other colleagues and other authorities, and we developed a standard template for schools, and we tested that across the West Partnership. So what we have now is a standard template for schools that's prescriptive in certain ways, but flexible enough to allow schools to look at their own individual needs and resources and supports and fit that into their policy. And this was developed by a range of colleagues within schools and also through the Health and Social Care Partnership. So this was released in October 2019. It was done over 8 different events through what we call local improvement groups. So we brought in head teachers, deputy head teachers. We worked with them through the various activities of the One Good Adult and also looking at resilience. We then gave them the policy template and said, go away and fill that in for your own schools. And what I will do is share a copy of that template with the Parents Network so you can actually see what it says. I'll just show you some of the screenshots. So it's a kind of standard template where they can put the name of the school and their school logo, their mental health and wellbeing policy, and the table of contents down the right-hand side are sections that will support schools. So it's the rationale, who are the lead members of staff, so who's actually trained and how do you contact them. We talk about planning, signposting, warning signs, mental health guidance for staff, confidentiality, and then there's various appendices. And then within the appendices, they allows the flexibility for the school to add in what their offer is. So if they're working with a local partner or a local community support, then they can fit that in there within the circles that I showed previously in terms of community, family, and the young person. We have mental health guidance for staff. So this is a kind of handout that can be put up in walls, and we talk about confidentiality. So if you're talking to, we need to be honest with regards to the issue of confidentiality. Who are we going to talk to? What are we going to tell them, and why we need to tell them that? And then we've also got a section in here about working with parents and carers, because through the working group, we were quite clear that the person that probably knows the child best, and that definitely does know the child best, are the parents and carers. So we have to work with parents and carers. So it's quite specific in there about how we actually work with parents, and that what we were hoping for, that this would be a co-production, and that you'd actually be able to work with the parents and carers in developing their school policy. This has probably stalled a bit because of the shutdown that happened. The plan was that we were going to give them up until June this year to develop it, and then we start to look at examples of that. It's something we'll have to revisit, but we've already had some discussions with health improvement colleagues about how we actually get this started again and progress this. And I think in time we will find that all schools and early learning centres will actually have that policy. And it might be worthwhile if you're interested in asking, do they have the policy, and can you actually see it, and can you feedback on it? I'm going to talk about supports available in Glasgow schools regarding counselling. So you're probably a bit aware that the Scottish Government made a commitment that all 10 to 18-year-olds have access to a counsellor, and this came out in 2018 and has to be implemented by October 2020. I think there was some slide there because of COVID. Glasgow has already had counsellors in all our secondary schools as part of the health improvement contract. So Lifelink, which is one of the third sector organisations, had a contract to supply counselling to all the schools and has been supplying that. That contract ended in June this year, and we put in another temporary contract because of the value of the contract, we had to go to procurement and to formal tender, which has been quite interesting. So we're about to invite tenders for a 4-year contract for counselling in all our secondary schools, and also to primary 6 and primary 7 pupils. So it's been quite complex, because what we're trying to do is, again, fitting in with the kind of tiered supports within Glasgow, look at, can we offer a broad offer to young people tailored to their individual needs? So what we're looking at is a framework that will include one-to-one counselling in all secondary schools, and also to primary 6 and primary 7, group counselling within secondary schools and primary 6 and 7, group work within primaries, and various evidence-based therapies such as play therapy. So what we're looking at is a range of supports, and that will be supplemented by pupil equity funding. I'm quite sure most of you will be aware of the pupil equity funding that schools can actually use to support young people who live in the SIMD 1 and 2. So roughly the value of that overall contract will be £2 million a year over the next 4 years. But I think what is really important, and certainly the executive director's thoughts are, or desire is, that schools will decide what type of support best fits their needs or the needs of the individual children. So being able to have a broad range of supports, from counselling right down to individual aspects of play therapy, for example, is something that we really welcome. And because of the complexity of it, we hope to have that in place early 2021, probably January, February, and at present existing supports will remain until then. So if schools are accessing counselling using the funding, then that will continue. Nobody will be left without that support. But as of early 2021, then we will actually have a proper framework in place. And I should also say, part of the reason for doing this is to ensure that the positive outcomes and the impact on young people. So we actually have a quality assurance team to ensure that if support is in place, we actually see benefit from that. So it's not just the number of young people being seen, it's, do we see benefits in their well-being? So things like attendance and other range of measures to see is there an improvement following the counselling or therapy. Moving on to kind of digital supports, I just wanted to show you this website called iMind. It's www.imind.com. This was developed several years ago by Greater Glasgow and Clyde NHS in collaboration with Snook, which was a design agency, the Mental Health Foundation and Young Scot. And it's a kind of practical toolbox for young people, but also professionals, around mental health. And it's freely accessible. It's well worth having a look at. There's some really interesting lived experience on there about young people who have experienced mental health problems and how they dealt with it. And it's updated regularly. So really well worth looking at, age 30 to 21. So it's freely accessible, and you can link it, you can connect using the links here. And there are various toolkits within that to help assist you youth workers when using digital approaches to mental health. So there's activities there about mental health and why digital, and some really good links there. So well worth having a look at. The one I'm really keen to talk about tonight is something that we brought in. We started looking at this in November last year, and then we were able to get funding to do this. And this is what was previously known as Big White Wall, and it's an online support platform for 16 to 18-year-olds. They had to rebrand over the summer, and they're now known as Togetherall, and the link there, www.togetherall.com. If you click on that, it will tell you more about the site. It is free for all 16 to 18-year-olds in a Glasgow postcode. So we have purchased 15,000 licenses. So that will cover everybody over the age of 16 up to 18 in Glasgow. So that's effectively S4 to S6. And the reason that we selected Togetherall is that it's a very protected platform, in that it's moderated by watchers, or what they call wall watchers. So it started off a number of years ago at a university where young people would put their concerns on a piece of paper and stick it on a wall, and then somebody would come by and make a comment about how they dealt with that issue. So they've moved on from that, and now they've got, I can't remember the numbers, but a lot of organisations, NHS, the Ministry of Defence, universities use Togetherall. and Glasgow was the first local authority to bring it in. We've had some really good dealings with Togetherall, excellent communication, and the sign-up rate has been relatively low. The problem was that the date we went live, which was the 1st of April, was a week after the lockdown. So all the schools were closed and we couldn't really get any of the materials out. So although we tried to get out through various means, through Twitter and schools sending emails out, the actual physical information that we've got, we were unable to send out. So I'm really trying to push this because I think it's a really superb platform. As I said, it's clinically supervised, which means if a young person puts something up that says, you know, that there was negative or they've been bullied, then the wall watcher will actually intervene and either redirect the conversation or suggest that they maybe seek support elsewhere. It's a peer support platform, but they also have some excellent self-help and awareness raising courses. So it's things like alcohol, substance abuse, keeping fit, but the mental health input, and also they've got some very specific resources to do with COVID. So all you have to do to sign up is that you need to have a date of birth that is 16 or over, have a Glasgow postcode. You put in an email address. Now this can be a disposable email address. The only reason that you need an email is that they send you a link. You then create an avatar or a nickname for yourself, and then you can log in anonymously. It's not a crisis site, but some of the feedback from the people who have been using it, when we get the anonymous responses, is really, really positive. And I think it's something that might be well worth looking at. If you've got a 16 or 18-year-old, they can access it. It's actually designed very well to be used on a smartphone, or a tablet. So it's something you might want to be thinking about. And I keep on saying it's totally free. In terms of loss and bereavement, we use and refine the loss and bereavement toolkit, which was developed along with health improvement and also the Princess of Wales Hospice. And that's continued to be used by staff in our schools. We offer Seasons for Growth Reconnector sessions across the city, and we also offer the training to education staff, third sector organisations, and we also work with Education Scotland in developing training across local authorities. If you're interested in any of this, further information, we can provide this to you. I wasn't going into too much detail, but it's something that we significantly invest in. And it's not just to do with bereavement, it's also to do with loss, that families who split up will have a significant impact upon the young person. So as I kind of progress through it, I've got no idea if you're all still with me, but responding to distress, I want to talk about suicide prevention. So this is something that a lot of people actually ask about because it's a really challenging area. So we continue to use applied suicide intervention skills training, which is called ASSIST, across all learning communities. So every learning community, there's 28 learning communities across the city, which is the primaries and secondary schools. So there's a protocol in place that if a young person was to talk about suicidal thoughts, then support can be provided either through the school if they've got an ASSIST trained member of staff, or the educational psychologist linked to the school, because all educational psychologists are ASSIST trained as part of coming into Glasgow. There's always a demand for ASSIST training. They run the courses every couple of months, or they were until it was prevented at present because of the restrictions. But we now have 3 ASSIST trainers within Education Psychological Service, contributed to the ongoing training programme. We're really lucky to get another 2 people on the course. This was actually funded by some money through addictions, and we managed to run a course for 13 staff, 13 staff, and 2 of them were educational psychologists. So it really welcomed, and I hope over time we can actually achieve more training about education staff. It's a very, very good course, very demanding course. It's a 2-day course, ASSIST, very draining, very emotional, but it really trains you up to actually support somebody who's actually thinking about taking their life. We also encourage schools to have at least 1 member of staff trained in Safe Talk, which is a 3-hour training programme which prepares people to actually ask the question, are you thinking about suicide, and what are you going to do? And at present, we're also looking at a project at the minute, looking at what's called Living Work Start online training. So this is a 1-hour module that we've been offered from Living Works in Australia. and we're about to trial it with 35 members of staff. We've also been able to access the course for all staff in education headquarters, because I think we have to be aware that a lot of education staff are probably under a lot of pressure at present, and may well be receiving telephone calls from parents, carers who are really stressed or in not a good place. So we're about to undertake 65 members of staff within education headquarters. Will be offering the training. It's an online introductory course. I completed a couple of weeks ago. It's a very good course. It's a Canadian, it involves video and role play online, but well worth looking at. And that's something that hopefully one day I'll be able to give you an update. I would really like to be looking at offering this to all pastoral care staff across the city, depending on how we actually go with that. I also like to touch on suicide prevention for S5, S6 students. It's something we've really been looking at. I was very keen a number of years ago to look at training for 5th and 6th year pupils on Safe Talk. However, there are difficulties doing that in terms of accessing the 3 hours and also in terms of trainers. So an opportunity arose when one of the film companies from Glasgow called Stone Scissors Paper made a film called Bridge. It's about a 9-minute film, and it was filmed on Kelvin Bridge. It was released at the Glasgow Film Theatre in 2018, and it was really well acclaimed. And the director, producer-director, were very keen to look at how the film could be used more broadly. So we had a discussion and suggested that we would like to explore creating a curricular resource for Glasgow schools. And we asked a couple of secondary schools, Holyrood Secondary and also St Andrews Secondary, pupils to look at how we could use that. Eventually, we managed to get a resource developed using some of the students at St Andrews Secondary School by a member of the drama department. And she created 3 40-minute lessons, activities around the film. So basically they watch the film and then they undertake various discussions about mental health and also suicide prevention. And the view is to try and get them talking about it. It was also then, we also were able to film their responses. The director came back, the producer then came back and shot a feedback clip with the young people, which we've used within schools, and certainly most of the secondary schools, if not all in Glasgow, have actually adopted this and will be offering this to pupils. It's not mandatory, but again, if they want to participate in the programme, but the feedback was pretty phenomenal. There was a licensing issue, so again, through working with Pauline Tora, the Choose Life coordinator for Glasgow, and the Health and Social Care Partnership, we managed to access some funding for that, and we now have a licence that we can use it in all Glasgow secondary schools until July 2023, at which point it will be reviewed. So it's just like an example about a bit of innovative thinking about how you can use something that was developed in Glasgow, but is now been actually used by young people in Glasgow. Finally, I'm going to move on to, again, distress, what's the harm training. So this is a self-harm awareness raising training that was developed by NHS Greater Glasgow and Clyde Health Improvement colleagues. A really good programme. It's a day's training, and feedback again has always been really, really positive. What we were looking at is the sustainability, about how we can actually roll this out. So we've actually taken a plan where we have now got 3 trainers within the Glasgow Psychological Service who can now train other staff as trainers. So it's training the trainers, and the idea is it's a cascade model, and we're now putting into place a 5-year plan, depending on restrictions about face-to-face training, to have 2 what's the harm trainers in each secondary school. So what we'd like to have is 2 members of staff who are what's the harm trained, and then they can train other members of staff within the school. So it's a cascade model, and I would hope over time in Glasgow we could have at least 1 person who is what's the harm trained within all our primary and secondary schools. And basically what the course does is allow you to think about self-harming in a different way. So it's not necessarily about prevention, but harm minimisation, and actually looking at what are the other issues related to distress that are causing the young person to self-harm. So it's a really innovative and a very effective programme. And getting there now, I've got no idea what time it is, so we're rattling on now 50 minutes. So the Joint Education Glasgow Health Social Care Partnership Mental Health Action Plan. So previously, as I said, we had a 3-year plan that was specifically to do with education services. And I think that was quite important because it tried to get education to look at what we were doing and help head teachers and teachers think about the huge amount of work that they were actually doing and how they fitted it into the framework. What we're now looking at is working with specialist children's services, health improvement, and the third sector, which I think is really important, to develop a joint action plan. So we're looking at a plan 2020-2023. We've started that last week. We're hoping to have it in draft form probably over the next month or so. But what the real focus is on tier 1 and tier 2 supports, and that's prevention and early intervention services. So we're not really focusing on what CAMS are doing, because CAMS tends to be at tier 3 and tier 4. We're actually looking at that early intervention and prevention. So we're getting our heads together, looking at what funds are available, what resources are out there, and can we actually put together an action plan that everybody's working towards in terms of mental health in Glasgow. Some of the key focus will be core awareness training for all staff, so that everybody is aware about mental health. So the information I've been trying to talk about tonight, that they have that understanding, that it's not somebody else's problem, or I need to refer on, that I can actually be that one good adult, or I can ask the question, you know, are you all right? I think suicide prevention is going to be another key factor in relation to supporting distress and self-harm awareness. I think they are separate things, and we're about to revise the guidance on that. And I've put a question mark down at the bottom because I'd be really interested to have feedback from the Glasgow Parents Network on what you think should be within a mental health action plan. There'll be various engagement events as we move through, but if there's anything from tonight that you've heard and you think, wait a minute, something's missing there, I think if you want to go through Leanne, I'd be delighted to hear if there are aspects that you think we should be looking at, or that we're missing out on, or if you've got resources out there that you think we're not tapping into. Some of the websites, again, you can access these links. The NHS website, Useful Rules of Living Life, is very helpful. Lifelink, the iMind, and I really like the bottom one, the Charlie Waller Memorial Trust. There's some really good information there. The Mental Health Action Plan is based on one of the templates that we can modify to fit into getting it right for every child and nurture within Glasgow, but some really good downloads within that, totally free. I would also like to kind of promote the Glasgow Psychological Service website. That's their HTTP blogs Glow Scotland. So if you kind of copy that into your browser, it will take you to the Glasgow Psychological website. The reason I'm showing that is there's a mental health section within there where all the resources that I've been talking about and working on are available for download. You don't have to kind of register for that. But we have also been working significantly over the past 5 months during the lockdown period on the coronavirus and education. So we've actually been looking at all the resources that are out there to support young children, young people, families, and also professionals. We've put the links into those sections and not effectively quality assured, but had a look at what we think is probably quite helpful for you. There's also a number of videos or tweets that have been put up around things like supporting young people with speech, language and communication needs, autism spectrum disorder. So some of my colleagues within the team have actually put up video blogs about what you can actually do. So I'd strongly suggest if you're really looking for some support, have a look on there, and if it's helpful, you can download those.